Hello, everyone. Thank you for joining us today at our virtual reality naloxone training simulation webinar. As many of you know, we are thrilled to partner with Walmart to present this unique virtual reality training experience. We initially launched this simulation back in February 2000 at CADCA's National Leadership Forum. We then engaged with many of our amazing coalitions to learn how communities can host events using this technology. We had amazing initial feedback, including how to use this VR tool as a standalone awareness event, create a training around it, or add it to trainings that are already being held. Just as we were starting to host in-person community awareness events using the technology, we all know what happened and we moved to virtual everything. And while we're hoping the last half of this year might allow us to have more opportunity to host events back in person, we're currently hosting events virtually, and we are thankful to our amazing CADCA members, and specifically today, thankful to our good friends, Ms. Anna Godwin and Ms. Erin Day, and the team at Community Impact North Carolina for being our co-hosts. Before I kick this off to hear from our esteemed group of speakers, I want to let everyone know the goals for today. First, we will hear from a wonderful group of speakers here in North Carolina who are working every day to save lives and who we are honored to be part of this event today. Then, along with the Walmart Academy team led by Julie Stevens, we will view a virtual reality simulation that demonstrates a few different scenarios on how to recognize when an overdose is happening and how to administer naloxone. We will follow along with the Academy lead who will be experiencing this training in a VR setting while wearing the Oculus headset. Lastly, we would love your valuable input while learning from you all in attendance today, how you might use this virtual reality format in your communities. We plan to learn from these events how to roll out this technology nationally and what resources we might need to accompany this goal. So again, we would love your valuable input. After we hear from our speakers and see the simulation, we'll have a few minutes for some guided Q&A. I'll ask a few questions at the end of the hour, and if you would please type your answers into the chat, we appreciate your input. Additionally, in the weeks to come, we will reach out to you all as a group as well to get more input from you. Our President and CEO, General Barry L. Price, is typically our next speaker. Unfortunately, he's not able to attend tonight's event. He did, however, want me to express his apologies for not being here and also thank you for the work and impactful collaborations you are achieving throughout the state of North Carolina. CADCA is excited to join today Anna Godwin and Erin Day, CEO and COO from Community Impact North Carolina, Dee Dee Saravino from the Addictions and Management Operations in the Division of Mental Health for Developmental Disabilities and Substance Abuse Services at the North Carolina Department of Health and Human Services, Regina Cothran from People of Clay Care, Amanda Isaac, a pharmacist in the Division of Public Health of the Injury and Violence Prevention Branch in the North Carolina Department of Health and Human Services, Julie Stevens and the amazing team from Walmart, and other leaders from the state of North Carolina. We're honored to join you for this training and virtual demonstration on how to save a life by reversing an opioid overdose. On behalf of General Price, I would like to personally thank Walmart for their investment in not only this technology, but for their investment in the people who will benefit from this life-saving training. And a special thank you to everyone on today's webinar. We hope this unique event will train you on how state and local agencies are collaborating to combat the opioid epidemic in our communities. CADCA has a footprint in over 30 countries worldwide. We have more than 5,000 coalitions across the United States and over 90 coalitions here in North Carolina. We have sought to train community residents and leaders to build and develop coalitions in their communities and reduce substance use by adapting CADCA's model for community change. Recently, the CDC reported that 91,862 drug overdose deaths occurred in the United States in the 12 months ending in October 2020. That's the largest number for a 12-month period ever recorded. Think about that. Almost 92,000 people died of overdoses. That number in North Carolina is nearly the size of cities such as Greenville and Asheville. CADCA wishes each of you success in your direct communities, and we ask you to join us in becoming one CADCA. We cannot do this without you. You are the true heroes in your community. We're excited to be part of this event today with our partner, Walmart, who has developed this amazing virtual reality tool to deliver a powerful element to naloxone and overdose reversal trainings. It has never been more important to know how to save a life, and our coalitions are at the forefront of efforts in their communities and making a tremendous impact. It is now my pleasure to introduce you to Ms. Anna Godwin, a licensed clinical addiction specialist and certified prevention specialist, as well as CEO of Community Impact North Carolina, and Ms. Erin Day, a trained recovery coach and chief operating officer at Community Impact North Carolina. Both Anna Godwin and Erin Day are longtime friends and members of CADCA, and Erin will talk with us today about North Carolina's community prevention work.
Good evening, everyone. We'd like to thank General Price for this opportunity, as well as CADCA and the Walmart Academy. We're really excited for this opportunity to be here in North Carolina to talk about naloxone and administration and how important that really is for the citizens of our state. So I'm Anna Godwin. I'm the CEO at Community Impact NC, and this is Erin Day, our COO. And we're just going to take just a couple of minutes to talk about our organization and some of the services that we provide in the state of North Carolina. We are a statewide nonprofit. We're based out of Wilson County, North Carolina, but again, we serve the entire state on issues as it relates to substance misuse prevention, and as that carries over into the full continuum of care and looking at partnering with treatment, recovery, and harm reduction to successfully provide supports in our state. And so one of our primary things that we do is provide coalition support that Erin will talk about just in a minute here. And then we also work to coordinate some prevention dollars as it relates to the state opioid response grant. We also coordinate North Carolina's opioid summit that happens biannually. So we do a lot of things throughout the state to support communities. And we wanted to take this opportunity to let you know that if we're not involved in efforts in your community, we would love to be involved. And so our contact information will be available at the end of today's webinar, and please reach out to us if there's anything we can do to support you. I'm going to turn it over to Erin to talk about what our coalition support looks like.
Thank you, Anna. Yes, good evening, everyone. Thanks for joining us tonight. I know that everybody's anxious to get to the main reason you're here, so keep it brief. As you'll see on your screen, there are two maps, and what those two maps denote are the coalitions that we've identified in the state and the recovery community organizations and recovery community centers that we've identified. We keep a running list, and of course, as soon as we update it, things change, but we keep a running list on our website. Each of the pins are clickable, and they have meeting information, they have contact information, they have website information. We wanted to provide this to you so that after tonight's webinar and the demonstration that you see, if you are interested in getting connected to your local recovery community center or organization or community coalition, that you're aware of where you can find that information so that you can get involved, so that you can get engaged, so that you can learn how to access naloxone in your community, and be part of the solution for keeping the citizens of our community or our state safe, like Anna mentioned at the beginning of her remarks. So again, we're really glad that you're here, and hope that you find the information useful tonight, and that you maybe make a decision to get involved with your local coalition or RCC or RCO.
Thank you so much, and we're going to turn it over to the next speaker.
Thank you, Anna and Erin, for taking the time to be part of this event and for everything you do every day for North Carolina families. Next up is Dee Dee Saravino. Dee Dee has served as section chief for the Addictions and Management Operations team in the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services since 2016. In that role, she oversees a team responsible for clinical policy and program development for adolescent and adult addiction treatment and recovery services across the state. Prior to joining the division in 2013, she worked at Wake County LME for 9 years in community and provider development with a focus on substance use disorder. In total, she has nearly 30 years of experience in the publicly funded substance use disorder field, primarily as a government employee, but also including direct service provision and prevention programming. We turn it to Dee Dee.
Thank you so much. On behalf of the North Carolina Department of Health and Human Services and the Division of Mental Health, Developmental Disabilities, and Substance Abuse Services, I want to say thank you for joining us today. I'm grateful for your interest in this topic. As stated, my name is Dee Dee Severino, and I'm the Section Chief for the Addictions and Management Operations team. The work of our team is focused on policy and program development specific to addictions, treatment, and recovery across the state. We also consider the distribution of naloxone to be one of our most important initiatives. We are all, unfortunately, very familiar with the opioid epidemic. It's been with us for many years. In fact, we can track the beginning all the way back to 1991, when we first saw sharp increases in opioid prescribing. Around 2010, we began seeing increases in deaths due to heroin overdose, in part due to early efforts to curb opioid prescribing. But then the sharpest rise in opioid-related deaths occurred in 2016 as fentanyl and fentanyl analogs became more prevalent. North Carolina was one of 19 states that saw significant increases in drug overdose death rates between 2014 and 2015. In 2019, which is the most recent year that we have complete data for, nearly 5 North Carolinians died every day from an unintentional opioid overdose. That's over 1,800 people. And although strategies such as North Carolina's STOP Act have successfully regulated opioid prescribing, it unfortunately appears that the downward trend we were beginning to see in the last couple of years may have changed directions in 2020 and early 2021. And although, as I said earlier, the death data is incomplete at this point, we believe many deaths will be attributed to fentanyl and fentanyl analogs. According to 2020 census figures, there are slightly over 9.1 million people in North Carolina aged 12 and older. And of those, more than 350,000 misused prescription opioids or used heroin in the past 12 months. Combating the public health emergency like this takes a multi-pronged approach that includes access to prevention, treatment, and recovery supports. It also includes harm reduction and intervention strategies, such as widespread distribution of naloxone to keep people safe until they access care. As a state agency, we made our first purchase of naloxone for distribution in June of 2017. Since then, we have purchased and distributed almost 300,000 units of naloxone, both the intramuscular vials and the Narcan nasal spray, at a total cost of nearly $12 million. Our most recent purchase was this past April, where over 78,000 units, both intramuscular and nasal, were purchased and distributed to more than 200 agencies. Distribution sites include all North Carolina local health departments, all of our opioid treatment programs, of which there are about 80 to 82 at this time, as well as all the syringe services programs. It also includes law enforcement agencies such as local police departments, sheriff's departments, campus police on college campuses. It includes EMS, not for their use, but for what we call leave behinds, where naloxone is left with the individual who experienced an overdose that EMS responded to. We've also distributed to other community organizations and coalitions, other treatment providers. We have attempted to distribute as broadly and widely as possible across the entire state. It's taken the work and partnership of many to implement distribution so broadly. And while I'm pleased with the effort, the asks and the requests always exceed what we have available. We have and will continue to work diligently to advocate for, apply for, and identify naloxone funding through federal block grants, federal discretionary grants, and state funding. Thank you for allowing me the opportunity to speak about this important topic today. I'm grateful for our local partners, including Community Impact North Carolina, as well as CATCA and Walmart, for their continued focus on training related to opioid prevention and intervention. Only through these types of collaborative efforts at the federal, state, and local levels, as well as public and private partnerships, can we reach our goals of improving acceptance, accessibility, availability, and utilization of naloxone. Thank you so much.
Thank you, Dee Dee. Thank you for those remarks and your leadership and really helping us to better understand some of the really impactful work you're doing there in North Carolina. Now it's a pleasure to introduce Regina Cothran. Regina is the Community Outreach and Youth Engagement Coordinator for People of Clay Care, Coalition Allies for Recovery and Education, based out of Clay County, North Carolina. Regina is excited to be working in the community as one of the co-coordinators because she believes in the Greenville community and is excited to be part of the mission of advocating for a healthier, safer community for all citizens of Clay County. She is a master's social work candidate with a passion for working towards social justice. I'll turn it to you, Regina.
Hello, my name is Regina Cothran, and I am one of the coordinators with People of Clay Care Coalition Allies for Recovery and Education, based out of Clay County, North Carolina, in the Western Carolina region. Our mission is to advocate for a healthier, safer community and reduce substance use disorder by offering education to the schools and all citizens about prevention, resilience, and responsible choices related to alcohol, tobacco, vaping, prescription drugs, and other substances, and to be an ally for those in recovery as well as those seeking recovery. Today, I want to talk about our coalition's allyship with the recovery and harm reduction community efforts. One of our coalition's goals is that our coalition will be an ally to everyone in recovery or seeking recovery, to family members of those in recovery, and it will be a source of information about intervention, treatment, and transitional programs to help enable recovery. While People of Clay Care Coalition's efforts are focused on primary prevention efforts, we recognize the need to collaborate with and support recovery and harm reduction efforts in our community because it takes a community of all of our efforts to advocate for a healthier, safer community for all of our residents. One of the ways that our prevention coalition has supported recovery and harm reduction efforts is by inviting a harm reduction organization from the surrounding county area to set up in a public location and distribute free naloxone and Narcan in our community and train the community on its importance and how to administer it to help save a life. As of 2015, 6 years ago, North Carolina had experienced a 73% spike in opioid-related deaths since 2005. Our own rural community of Clay County has also unfortunately seen these effects. One of these instances, the harm reduction organization was invited into our community by our coalition to distribute naloxone, happened after 5 young adults from our community passed away from overdoses within a week. Hundreds of naloxone kits were distributed that day. After hearing about our collaborations on the Harm Reduction's Naloxone Initiative, a mother reached out to a member of our coalition. Her daughter and friends were friends of some of those who had passed away, and the mother said that they were very afraid. She wanted to host a training in her house with her daughter and friends so that they too could be trained on how to use naloxone to save a life. We were able to put the mother in contact with the harm reduction organization, and they were able to thankfully provide training for the young adults in our community. Our coalition has learned from experience that if you're going to partner with harm reduction efforts such as naloxone distribution, then you should check to make sure that the location you intend to distribute at ahead of time is okay with that, since there is unfortunately still a stigma in harm reduction efforts. While our main efforts are focused on primary prevention like education, on locking up medications and safely disposing of unused medications, we recognize the reality of drug misuse and see the importance and need for recovery and harm reduction efforts in our community to reduce harmful consequences such as death. We continue to be an ally for their efforts and will continue to support their initiatives however we are able. We have experienced firsthand the importance of naloxone in our small county, and we are just one small example of a collaboration between preventionists and the recovery community. You may have heard the story of the babies in the river. You look out your window and see a baby in the river, so you rush down to save it. Then another baby appears, and another, and another, and another, and they just keep coming. You spend the whole day saving babies from out of the river. Others join in your efforts to save babies from the community. It took a lot of great effort, and you've begun to organize your activities in order to save the babies as they come down the river. As everyone else is busy in the rescue efforts to save the babies, two of the community people start to run along the side of the shore up the river. "Where are you going?" shout one of the rescuers. "We need you to help us save these babies." "We're going upstream to stop whoever is throwing them in," they say. They see a big, scary monster tossing baby after baby into the river. Prevention focuses on the big, scary monster throwing babies into the river. But meanwhile, there are still babies drowning in the river, and the recovery and harm reduction communities are working very hard to save those babies in the river and need to be supported by primary prevention coalitions. Naloxone is just one important initiative that helps save the babies drowning in the river. I urge you to think about partnering with recovery and harm reduction efforts if you are part of the primary prevention community, because coming together creates an easier workload at the river for all of us. Doing so has been crucial in our own community, and we've seen how many lives that it has saved in just our community of Clay County. So thank you so much for having us, and I hope you enjoy the rest of the talks and have a great day.
Thank you, Regina, for your tremendous work in North Carolina and for really just such an impactful conversation that you just had, and really being part of this, and ultimately for your friendship with us at CADCA as well. Next up, we'll hear a few words from Amanda Isaac, who is the pharmacist at the Division of Public Health, Injury, and Violence Prevention Branch at the North Carolina Department of Health and Human Services. As a practicing community pharmacist, she has been actively engaged for several years, leading key pharmacist initiatives on addressing the opioid crisis. Amanda will talk to us today about naloxone trainings, the work of pharmacists with overdose prevention, and naloxone access in North Carolina.
Good evening. It's great to be with you all today. My name is Amanda Isaac, and I'm a pharmacist with the North Carolina Division of Public Health. As a practicing pharmacist myself, I recognize the tremendous role that pharmacists and others play in increasing access to naloxone in our state. As most of you know, naloxone is an opioid antidote that's used in emergency situations to restore breathing of someone who's overdosed. It's a safe, effective, and life-saving medication. Expanding access to naloxone is a critical priority of our state, as you've heard in previous comments. This is our state's recently updated Opioid and Substance Use Action Plan, which lays out several different strategies our state is taking to address the opioid crisis and reduce fatalities due to overdose. It's a three-pronged approach focused on prevention, reducing harm, and connecting people to care. Under reducing harm, one of the priority actions is making naloxone more widely available. As you've heard from Dee Dee, we've come a long way in expanding access, but I also wanted to give some background on where we started. In 2013, General Statute 90-12.7, also referred to as the Naloxone Access Law, was passed. This allowed for healthcare providers to prescribe naloxone either directly or by standing order to people at risk of an overdose and those who might be in a position to assist someone at risk of an overdose, also called third-party prescribing. The law also provided civil and criminal immunity for people prescribing and administering naloxone. In 2016, legislation was passed that authorized the state health director to sign a standing order that allowed for pharmacists licensed by the North Carolina Board of Pharmacy to dispense naloxone to eligible persons without requiring them to have a prescription from their doctor. The intention of this standing order is to be as broad as possible so that anyone at risk of experiencing an overdose, their family members, friends, or anyone in a position to assist could walk into a pharmacy and request naloxone. This could include a concerned family member, a librarian, a law enforcement agent, and beyond. Naloxone can be processed under insurance if the person requesting it has coverage, and we do find that most insurance plans cover at least one form of naloxone. In North Carolina, we do not have any age restrictions on getting naloxone from a pharmacy. In 2017, access to naloxone was expanded even further when a provision was added to the law that allowed for organizations that promote scientifically proven ways of mitigating health risks associated with substance use disorder to distribute naloxone. So this includes organizations like harm reduction agencies, faith-based facilities, and health departments to distribute naloxone out in the community under a distribution standing order. Around the same time, we developed the website naloxonesaves.org, which is our state website for all things naloxone. On this site, you can find where to obtain naloxone in your county, patient education materials if you're a provider, treatment resources, and other strategies for overdose prevention. If you haven't already checked out this website, I would highly encourage you to do so. This is a map on the website of all the pharmacies in North Carolina that have indicated to DHHS that they are dispensing naloxone under standing order. So you can sort by county and find your nearest pharmacy. Last I checked, we had over 1,600 pharmacies listed on the site. But pharmacies aren't the only place you can go to request naloxone. Because of our expanded naloxone laws in North Carolina, well over half of the local health departments dispense naloxone at no cost. The billboard there on the right picture is one put up here in Raleigh recently by the Wake County Health Department. We have over 40 syringe service programs that have distributed over 50,000 doses for free of naloxone over the past year. Also, many of the treatment facilities and opioid treatment programs provide naloxone to patients and their family members. You can find a list of health departments and syringe service programs that offer free or low-cost naloxone at naloxonesaves.org. I quickly wanted to highlight our North Carolina Opioid Action Plan data dashboard. This dashboard allows you to view each county's progress on each strategy of the Opioid Action Plan. So looking specifically at the strategy around expanding naloxone access, we can see statewide that about 44% of the state has at least one access point for naloxone, whether that's through a pharmacy, health department, EMS agency, syringe service program, or other organization. So we've come a long way, but still have a lot of work to do, particularly in our rural parts of the state. Well, lastly, these are a few of my favorite resources, both for pharmacists and organizations that are interested in distributing naloxone. We have an extremely comprehensive toolkit that has everything you ever wanted to know about setting up a naloxone program. It's a great resource for health departments and other community-based organizations. For pharmacists, we have a one-page FAQ on the standing order and have also worked with the Governor's Institute on developing videos related to naloxone dispensing. And lastly, morepowerfulnc.org is a great overall resource to learn about our state's response and how you can be involved. In closing, naloxone is a safe and effective medication, and expanding it is a critical strategy of our state's opioid and substance use action plan. Pharmacists, other healthcare providers, and community organizations play an essential role in expanding access. So I would encourage everyone to do your part where you can, whether that's distributing naloxone, carrying it, or both. If anyone has questions about accessing naloxone or starting a program, please feel free to reach out. My email is listed on the slide here. Thank you again for taking the time to be here, and I'm happy to take any questions.
Amanda, thank you. That was just unbelievably important information and just tremendous, tremendous work on everything that you're doing, leading pharmacists to combat the opioid crisis. Thank you. Finally, I'm going to pass it on to our helpful partner, Julie Stevens, and the team here at the Walmart Academy, who will walk us through the virtual reality simulation. The Academy team will wear the headset and allow us all to experience the virtual reality demonstration along with them. Julie?
Thank you, Reiko. My name is Julie Stevens, and I am a senior manager with the Academy Operations Support Team at Walmart. Walmart has invested in our associates by creating the academies, which are dedicated facilities for hands-on training that combine classroom and sales floor training for our associates. The academies have also partnered with our communities in various ways to provide continuous learning opportunities. One of the ways that we can provide content to our participants and community partners is through virtual reality. Virtual reality helps us recreate situations that are not easily replicated in the classroom or on the sales floor. I am now going to turn it over to the Academy team in Greenville, North Carolina, who will demonstrate how we leverage virtual reality. Chuck, Sadie, over to you.
Guess what I just swiped for my grandma?
What? Don't people get strung out on this stuff?
Yeah, that's the point. Come on.
These two industrious young gentlemen have stolen opioid medication for recreational use. Oxycodone, hydrocodone, fentanyl, and heroin are a group of chemicals referred to as opioids. The first three may be prescribed by a medical professional to treat pain, but they can be addictive and deadly, especially if not taken as directed. Heroin has no legitimate medical purpose. Opioid overdose is the current leading cause of death for people under 55. True or false? More than half of Americans have been affected by opioids. Correct. Over 70,000 people died of opioid overdose in the United States in 2017, and millions more were impacted through overdose or misuse. That means that if you have not been directly affected by opioids, someone you know likely has. But not every overdose needs to end in death. Today, we're going to teach you to spot the signs of an overdose and administer naloxone, a life-saving medication.
Hey. You okay, dude? You don't look so good.
Opioid overdoses will slow or stop your breathing. This reduces the amount of oxygen in your body, resulting in pale or clammy skin. The pupils will constrict until they are the size of a pin. The lack of oxygen can cause the fingers and sometimes lips to turn blue, gray, or purple, depending on the person's skin tone.
Your breathing is weird. It's too slow.
A very serious side effect of opioids is depressed breathing. During an overdose, their breathing will become shallow, erratic, or stop entirely.
Jay, wake up, man. Wake up or I'm calling the cops. John, hey, I'm not playing with you. Are you breathing? Dude, you're not breathing. Jonathan.
Loss of consciousness is the final tell of an overdose. If you suspect someone is passing out because of an overdose, you should scream their name and try to wake them to see if they will respond. As with any emergency, the first thing you should do is call 911.
911, what's your emergency?
Yeah, hello. I need help.
Naloxone is a life-saving medication that can reverse opioid overdose and restore breathing. There are several types of naloxone available, and all of them provide a life-saving medication in the event of an opioid overdose. In the example today, you will see the nasal spray Narcan administered. If you happen to have the injectable form, make sure to hold the needle straight and inject it into a muscle, like the shoulder or the upper thigh. First, peel back the packaging to remove the device. The device has a plunger and a nozzle. Hold the device with your thumb on the plunger and 2 fingers on the nozzle. Be careful not to accidentally spray the naloxone before you are ready. The device only has 1 dose, so don't test it out. Put the device right up their nostril until your fingers are touching their nose. Press firmly on the plunger to release the dose of naloxone.
Come on, buddy. Wake up. Come on, man, wake up.
After you administer naloxone, place them in the recovery position and wait for help. The person who overdosed needs immediate medical care. You should stay with them until help arrives in case they lose consciousness again. Another dose may be necessary.
There you go. There you go. All right, that's it. Welcome back.
Great job. When people think of overdose, they usually think of recreational opioid use like we saw here. This is a stereotype, and unfortunately, there are many situations that lead to accidental overdose. Let's take a look at other situations that can lead to accidental overdose.
Mom? 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 Mom, wake up. Mom? Not again. My mother is blacked out. I think she's had a heart attack. Send an ambulance.
Please stay calm. I'm going to check her vitals. What's her name?
Blanche.
Blanche, I'm here to help you, okay? Is that her? I'm going to check her for an overdose. She's got a pulse, but her breathing is slow. Let's check her pupils. All right, stay with me. Uh-oh, they're constricted. With this medication, this may be an overdose. Let's administer naloxone. All right, Blanche, stick with me, okay? 1 second. All right, I'm just gonna go right up here. The patient took too much of her prescribed medication. She forgot that she took her medication before breakfast and took another dose after breakfast. In the event that this had been a heart attack, naloxone wouldn't have been able to treat the heart attack, but it would generally be fine to administer to her without serious complications. Talk to your healthcare provider or check the package insert for possible side effects and additional information. All right, Eugene, got your stuff. Oh, no. Eugene took an old opioid medication that he had previously been prescribed for pain. Usually this wouldn't cause an overdose, but he's taking a new benzodiazepine medication. When opioids and benzodiazepines mix, the results can be deadly. Always check with your doctor or pharmacist before taking any medication, just in case there will be a negative interaction with your other medications.
Sending an ambulance right away.
Opioid overdose can happen to anyone. You can overdose from opioids even when taking a prescription exactly as your doctor prescribed, which is exactly what happened to me. All right, hotshot. I hope you're paying attention. it's your time to shine. Select the things you should look for when you suspect an opioid overdose. Now, let's review how to administer naloxone. Correct. You have to remove the device from its packaging. It will not do you a lot of good otherwise. Correct. That's how you hold the device. That's correct. You did it. You saved my life. Thank you for knowing what to do in the event of an opioid overdose. Accidental overdose can happen to anyone taking opioids, whether recreationally or even as directed by a doctor. This information can save a life. Opioid misuse is a national epidemic, and accidental overdose can happen to anyone taking opioids. It takes an entire community to keep all our members safe from overdose. If you or someone you care about is taking opioids for any reason, consider getting naloxone at your local pharmacy and keeping it on you at all times. No prescription is required, and it could save your life or the life of someone you care about.
So thank you to the Academy team for helping us today with the demonstration. And thank you so much to Walmart for hosting us and to all of the speakers here today who have taken time out to be part of this event. Now we would love to just get some feedback from our participants with some really quick Q&A. I'm just going to ask a couple of questions to our participants who are here today. And it would be great if you would respond by just using the chat. So we have about 10 minutes left, and I know we're going to get a lot of amazing feedback. So please know we're monitoring the chat, and we will be following up with you for separate and continued conversations. If we don't get to you, we definitely want to hear from you, and we'll be providing more opportunities to learn from you. You can reach out to us at CADCA at any time. My email address is rmendoza@cadca.org, or any of the CADCA team with anything that we may not get to tonight. So again, if we would just go ahead, I'm just going to be monitoring the chat. I think the first question we really have is, we'd just love to get some of your suggestions as community leaders as how might you use this training, this virtual training in your community, maybe as part of a training that you are already putting on, or build a training around, and you know, who would that be to? And we could give you some examples. You know, we've had really some people talking a lot about just educating the general population how to understand addiction, how to help someone who they love who's experienced an overdose, how to help remove the stigma associated with addiction. All of these are just, you know, great thoughts, great suggestions. Really, if there was any more that you guys might think of. You know, if someone has CPR trainings, that's great. Okay. Let's think of college orientation. We have heard a lot about that. Small businesses, we've heard. So much useful information. I was concerned about how to get parents to buy in after the stories and the examples from the Academy. I am prepared. Oh, that's wonderful. B. Whitaker, thank you so much. We really like hearing that. Drug-free workplace trainings. Yes, yes, love that. We're always thinking about that. High schools and colleges. I'll tell you one thing that I heard that was really powerful is Regina was talking today, our speaker, about a mother who wanted to host a training in her home. And so, I mean, this just got me really thinking, and I know we're gonna, add that just to our feedback. Military basic training. Yes. Yep, those are great ideas. So let me ask you this. What are some events or local community events that you have going on already where you could use this to help train people in naloxone education? And again, we have some things like take back events, church events. We've heard some feedback, PTA meetings, homeless shelters, scout meetings, 4-H. Yes. Great ideas, Donna. Thank you for that. Can we think of any just community events that you have going on? We also had some feedback once, which was really good, county and state fairs, especially, which we're thinking about that a lot about, now that we're reopening a little bit and we're getting back to some in-person events. Retirement and assisted living homes, yes. Recovery rallies, yes. Part of my job is employment. I would love to have this information at a job fair. B. Whitaker again, yes, we will be following up to you with that. That's a great idea. Farmers markets. All really great ideas. What training sites or groups, local sports team? If it's a VR simulation, Stephanie, if it's a VR simulation, Walmart could offer coupons for completing the simulation experience in their stores. Great idea. Tattoo and piercing parlors. Good. What training sites or groups, and I think we've covered that a little bit with some of your great ideas, but you have more. What training sites or groups might need this training the most? Like who would be the most interested? CPR and first aid trainings, the gaming community, high school health class. Caretakers, yes, social service professionals. Restaurants, a lot of overdose in restrooms, yes, and gas stations, really, really important. Security guards, military service members and their families, drug court counselors, you guys are amazing. Airline workers, libraries, bartenders. That's great. Keep them coming. While you're keeping this coming, I'm gonna ask another question that we'd love to get your thoughts about. So one of the questions that we have that we're thinking about, right, is where are the gaps in your community? And what I mean by that is not just where we can educate and train more individuals who need to know more about naloxone and who should have naloxone and learn how to use it. But we would also love to know, are there people in your community who need naloxone, but they can't access it or they don't have enough of a supply for it? For example, like volunteer fire departments, volunteer community health workers. Are there people in your community who just who are maybe first responders, like volunteers who need access? There's gaps in your communities and there just isn't enough supply. Oh, dental clinics that provide pain meds. Yeah, Donna. I believe our our law enforcement have trouble keeping enough supplies. Okay, it's good feedback. Volunteers at homeless shelters, really great feedback. Thank you, guys. Donna, budget cuts have been made, purchases difficult for law enforcement and first responders. Great. Carissa, I am the only Narcan distributor in my area. The local volunteer fire department and police department run out of nasal and aren't trained in intramuscular. Okay, that's really great feedback. The local volunteer fire department and police department, really important to know this. We really appreciate that. Great. Lifeguards during the summer. Criminal justice resource agencies. Recovery homes like Oxford houses. This is really great intel, you guys. Thank you. In rural areas, the rescue squads. Perfect. Okay. So this was just really tremendous feedback. I really want to thank everybody for being part of this event. We learned so much from you. I hope that through all of the speakers that we're all learning from each other, which is a really important part in the goal from all of this. We really want to extend our thanks to all of the speakers and participants for attending this event. We truly appreciate your time and insight. You are still going with some of this chat, re-entry councils, which is great. Please reach out. We have captured all of your comments in your chat and all of the great ideas. Please reach out to us at CADCA at any time, any member of our team. We will be reaching out and following up with you as well. We're very grateful for your tremendous feedback. Thank you again for all who supported. This was awesome. Thank you guys for attending, and you guys are awesome. The resource links as well, reach out to us for that, for anything that you need. Again, we're capturing everything in the chat, so we will be able to get back to you guys on all of that. Thank you for all you do. Thank you for all you guys do. Oh my gosh, just such thank you to everyone. I'm just reading the chat. There, Sean put his email address. Okay, so on that note, again, please reach out to us at CADCA at any time. We're going to go ahead and include this evening. We appreciate your time. We appreciate everything that you do. Please have a wonderful and restful long holiday this weekend. Thank you to everyone, and have a wonderful evening. Thank you all.